Hi, my name is J. Bolling.
And my name is Lupe Arteaga. We're students in the School of Public Health at Georgia State University. The COVID-19 pandemic has magnified the issue of health disparities in our society. What is a health disparity? It is the differences in health outcomes of populations based on social, economic, and environmental disadvantage.
Disparities in this country exist because of long-standing social and structural factors that determine good health, racism and discrimination, economic and educational disadvantages, lack of healthcare access and poor quality care, as well as individual behavior and biological factors.
Minority populations in the U.S. experience the most disparities in health outcomes related to COVID-19. This is because they mostly have a disproportionate burden of one or more diseases, such as chronic lower respiratory disease, hypertension, and cardiovascular disease, which when combined with the symptoms of COVID-19 makes it easier for them to be impacted.
Minority populations in the U.S. further experience disparities in health outcomes because they live in more crowded or densely populated areas, are more likely to be employed in public-facing occupations such as services and transportation that prevent physical distancing, and because they have genetic or other biological factors that predispose them to more severe forms of the disease. Cultural beliefs and practices, reliance on public transportation, and the fact that most of this population is often not treated the same as the majority population when they seek medical care also create health disparities from COVID-19.
Minority populations in the U.S. are overrepresented in COVID-19 reported cases and deaths. Although the total number of minorities living in cities and municipalities are low compared to the majority population, they account for most COVID-19 related hospitalizations and deaths. As a result, minority populations experience shortened life expectancy and premature death, among other things.
To reduce, or better still, eliminate the effects of COVID-19 on minority populations in the U.S., an approach that enables all to reach their full health potential should be used by health systems in the treatment of COVID-19 cases, so everyone receives the same quality of care. Preventative services such as COVID-19 testing should also be available to all. As most minority populations are essential workers, testing hours should be extended so they too can get tested.
To further reduce the effects of COVID-19 on minority populations, the words and terms used in brochures and other informational material need to be written in simple language, should include appropriate visuals, and should be translated into the common languages spoken in the U.S. To increase participation in contact tracing efforts, the importance of participating should be explained and fears associated with the effort addressed.
There must be continued data collection by federal, state, and local health departments and agencies on the effects of the disease on minority populations, so measures can be put in place to prioritize equity and to effectively manage the pandemic. Leaders and policymakers need to ensure that social and political factors that create disparities are eliminated. They also need to improve minority population access to housing and healthcare, among others.
As a minority student, there are so many things you can do to reduce or prevent yourself and loved ones from experiencing the disparities associated with COVID-19. Number 1, stay informed by reading all materials and information shared by the university. Number 2, do not congregate in spaces. Number 3, maintain social distancing. Number 4, enter and exit the classroom one person at a time. Number 5, use social media to share accurate information on best practices with friends and family. Number 6, acknowledge a social responsibility to protect others. Number 7, wash your hands regularly for 20 seconds and wear a face mask while inside campus facilities. And number 8, stay home if you do not feel well.
For further more accurate information, check out the Centers for Disease Control and Prevention at cdc.gov or Georgia Department of Public Health at dph.georgia.gov. Let's work together to put an end to this global pandemic.